Let's begin with the numbers. 2 dashboards up on the City of Austin dashboard. This is the main one we go to, always looking at admissions because that's the most at risk. We're at 11, which has been kind of consistent. The 7-day moving average dropped to 14, was 15. We've kind of flattened off at that place. The 4.8 number is still the infectivity that's in the community, roughly where we have been. 185 cases today. This is the concern. Cases that seem to be going up. You can see the 7-day average, 120. Why would we have cases starting to come up, but yet the hospitalizations don't seem to be going up? Dr. Escott said that we're looking at a younger and younger profile, more people getting it, younger age, end up in the hospitals less. But those younger people that get it, just as infectious as anybody else. So even though they don't end up in the hospital, if they're not wearing masks, if we're not wearing masks around them, if we're not all wearing masks, then those number of new cases just interacting in the community will start causing hospitalizations to go up. That's what other cities have seen. Let's go ahead and take a look at the second website, the second dashboard on the City of Austin, Austin Public Health COVID dashboard site. You can see the number of hospitalizations going down to 86. That's below the 93, which is a 7-day average. ICUs 33, 7-day average 36. On ventilators down to 18, 7-day average 22. Again, those numbers continue to drop. Concerned about the cases numbers that seem to be going up. 412 people in the city right now that have passed away. That's an increase of 5 people over yesterday. So still very serious, having serious impacts on people and their families. Let's go ahead and take a look at the exhibits that Dr. Escott presented to the City Council. The first one of these exhibits from him, you can see, is the number of new confirmed cases. This is what we were talking about just a second ago, the number of new confirmed cases. Look over to the right. The yellow line is the 7-day running average, and you can see how it has started going up on the right-hand side. That's the concern that we have. So we have to keep watching very carefully that number. Let's take a look at the next one of Dr. Escott's charts that we wanted to key up. Okay, let's blow up on this one if we can. This is the one that shows us hospitalization by race and ethnicity. The top line is the Hispanic Latino population. You can see that it was up to 70% in late May. That's that high point. If you look at where we are right now, this is second week in a row that we have been 43. It was 43.3 last week. It's 43.8. It's good to get it that low. It's still higher than the 37% that the Latino community is, but the numbers come down. The African American number is one of the numbers that seems to be going up a little bit. So we need to continue to watch that activity. That number is about 12.5% for the African American community. Their population about 7%. So on a percentage basis, that's where we're seeing the biggest disparity in our city. Let's go to the next chart from Dr. Escott. All right, this is the percent positivity in the community. You have 4 different clumps of graphs. That's week 34, 35, 36. We're now at week 37. The gray line in the middle is the Latino community. We're trying to get everybody below 5% positivity. You can see that each one of the demographic groups are below 5%, with the exception of the Latino community. That number now is below 10 for the second week in a row, which is good. but it seems to have plateaued out the last week. So it's down. The gray line's been going down. It has not gone down far enough. The other population groups, Black or African American, you can see in week 34 to 35 it was going down. Week 36 it was going down. Week 37 back up a little bit, still below 5%, but going back up. That's what we were talking about just a second ago in terms of that disparity. Let's go to the next chart from Dr. Escott's presentation. This is positivity by age. And you can see week 34, look at that kind of, I don't know, is that orange, third from the left? 34 goes up in week 35, goes up in week 36, and now up in week 37, above 10%. That age group, 10 to 19. 10 to 19 now is the age group that has the highest level of positivity in our community. I don't know if that's associated with, I don't know what that's associated with. Right now, we're looking at that number, continue to watch that number, concerned about that number. The orange group that's above 5% is 40 to 49. The gray group that's above 5% is the 19 to 29. So that group, 10 to 29, is the cohort that has the highest positivity in our community. We'll continue to watch that. Let's go ahead and take a look at the next drawing. Here's one that's interesting. It shows you over time what the new cases were in blue, what the 7-day moving average was for admissions, and then what the percent positivity was. Those are the dots. And you have all that information in front of you. As you get greater positivity in a community, you're going to have a greater number of cases. That's why the blue line starts moving up and peaks early as you get greater positivity in new cases. After that, you'll see the admissions to hospitals then kick into gear. And as the numbers go down, positivity will start going down first, number of new cases will start going down second, and then hospitalizations go down third because it's the most lagging indicator. From the date that we have positivity, about 21 days until that shows up as hospitalizations, you can see marked on here the day that the governor issued his mandatory masking policy. And you can see the numbers that start going down, but they're starting to go down at a period of time that is sooner than the governor's order. It's really that positivity number that's starting to go down. What happened 2-3 weeks before the positivity number started going down? That's when mayors and county judges across the state, including us here in Austin, were issuing our mandatory orders prior to the governor. That started us moving down. That is not to say that the governor's mandate wasn't really helpful. It was critical, because that has then all the elected leaders all singing from the same hymnal, all doing the same thing, all making it mandatory, which is an unambiguous way of saying that that's an important thing for us to do. Just thought that was an interesting chart. Different kinds of information on it. Let's go to the next page. Some studies that Dr. Escott talked about. People have asked, with that fine mist, the mist so fine that comes out just when we regularly breathe, so fine that it hangs in the air. It's borne by the air. It floats in the air and can be in a room. And it could be in a room for hours after we leave. It could be in a room 3 hours after we leave. Some studies indicate that incredibly fine particle, so that it floats, could be there 12 hours later. The question is, do people get virus from that? It's there, but it is in enough quantity to actually get the virus. Or do we actually need the droplets that are too heavy to be held by the air? That's when we sneeze and the droplets come out, they fall to the ground. That's how we set the 6-foot distancing, because most of those droplets will fall down before it reaches you at 6 feet. unless it's like a really heavy sneeze. That's why we still wear masks. The studies indicate right now, the doctor said, that the airborne transmission, that fine haze that could be just hanging there, probably is not a significant substantial way that this virus is spread. It's too fine, that mist, not enough quantity of the virus for most people to get sick. It's not altogether always true. You can still get sick that way, but just not as much. If you have ventilation in a building on the inside, certainly that helps so that you're not sitting in that mist for a long time. But what this study tells us is that the much greater threat is not the fine mist that can actually go through a mask. It's the particles. It's the droplets that the mask actually stops. He presented another study, a group of studies for us, talking about the treatment. You can go on to the next slide, Janine. He talks about the plasma treatment. This is where we take someone who has had the virus, has the antibodies, and we get their plasma. And then we, in our hospitals here in town, we then give that plasma to somebody that comes in. Does it help? And the answer is, based on the early indications, that it has some positive impact. Doesn't stop the virus, but it decreases the length of time, perhaps, that someone's in a hospital. It does help with a certain percentage of people that get a lot sicker. Studies still out. We still need to do some randomized controlled trials to see who it is that's going to most benefit from that treatment and what the protocols would be. But we're going to continue using it here in town. We were one of the first cities to really test that as part of a kind of a national consortium, and we're going to continue that work here.